Microneedling is a great treatment, especially if you have done some toxins in the past and you're like, what else can I do? Microneedling is probably going to be my answer for you because it is a physical injury as opposed to a thermal injury with a laser. So physical injury is just literally the pinning of the skin. So we can dial up or dial down the microneedling pin to the depth that we want to get into the dermis. And while doing that, we are improving pores, we are retexturizing the skin just from a physical point of view, but the main thing microneedling is known for is collagen induction without using heat. And so the downtime isn't as much. You may have 2 or 3 days of just kind of like flaky, dry skin, but that's the skin repairing itself. And we'll go over what products you should use before and after, but it is super simple, one of the easiest things you do at the practice, and I love pairing it with a toxin. So let's say you get your toxins 3 times a year. After you get your toxin, make sure you make your appointment for microneedling, and you'll want to do that 2 to 3 weeks after, so then you're getting the muscle relaxation and then the collagen induction of microneedling. Downtime is huge, and that's why we brought Moxi into the practice, is because patients wanted to make an improvement to their skin, but they didn't want a lot of downtime, and Moxi has been a workhorse in our practice. If you've never had a broad-based light or a photofacial, they call it IPL, that's great for just the reds and browns. You also can combine that with a Moxi. The difference between Moxi and like an ultra clear is Moxi is like aerating your skin. When we put the beams of light into the skin, we will bring up old skin damage. But with ultra clear, it's like we're mowing and aerating the skin. So we're taking the top layer off and we're aerating. So we're hitting it with much more heat, but you're gonna get much more of a result. You may be asking yourself, like, we've heard them talk about microneedling and we've heard you talk about Moxi. We have no idea what is what and why we need it. They both serve the need of collagen induction. One is a physical injury and one is a thermal injury. You're always going to get more from a thermal injury than you do a physical injury. But let's just say you have acne scarring. Acne scarring can be treated both ways. You can do microneedling or you can do Moxi. It's just if they are deep pitted scars, you're going to get more of a result from Moxi. But if you're scared of a laser and that's not your deal, then just go to microneedling. You're going to get a good result. You're just going to need more treatments.